Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by Dr. Pat Crowley, who's a retired GP from Kilkenny in Ireland, and he's been prescribing LDN since 2004. Today's radio show is sponsored by Merlin Pharmacy in Galway. They are Ireland's leading LDN pharmacy, offering trusted advice and genuine service. Their pharmacists have extensive experience in all aspects of LDN treatment. If you have a query, they are happy to help. Either email info@ifarm.ie or go to www.ifarm.ie, which is spelled IPHARM. Thank you for joining me today, Pat. We're very pleased to have you here with us, and we're dying to learn about your experience of LDN.
Well, thank you for having me. Yes. I came across LDN in 2004 when I read a newspaper article on it, and I started using it then.
Mm-hmm. Well, you've been in practice for 40 years. Would you like to just give us a brief overview of what you have done in that 40 years and what led you to LDN?
Yes, okay. Well, I graduated from University College Dublin in 1968. I went to America for my intern year. I went to Scotland for a year, and I went to England for a year before coming home to Ireland and establishing in a rural practice, in a village practice outside Kilkenny. And I started, many things during my period. I was there from 1972 up to 2 years ago. And I got involved particularly in the care of children with disabilities and helped to set up LARSH, which is a community-based organisation for those children and adults in Kilmagany, County Kilkenny. And we now have centres in Dublin, Belfast and Cork. And so that was a great success. Also, I helped to Camp Hill communities. They're an Austrian, German, similar kind of community, and they had one community in Ireland back then, and I helped them set up their 5 communities around here now, and 18 altogether in the Republic of Ireland. So that was very, very important. And also for old folks, I got involved in setting up community welfare homes for them, and they're very active now. So then coming to LDN and so on, in the early 2000s, I was very concerned about some patients of mine with MS, and I wasn't that happy with the treatments that were on offer at the time. People maybe had less frequent attacks, but the progress of the disease was not affected as far as I could see. So I read an article in the Irish Times then about LDN, which was being used in America. And I started using some of it, and I was very impressed with some of the results. And then I read another article by Mary Boyle Bradley. She lived in the United States, and she was mentioning how she had met Dr. Bihari. Her husband had MS, and she went to him with him, and he went on the LDN, and he's on it to this day and has done very well on it. So she organised a meeting with Dr. Bihari, and I went over to New York and met him, and some people from Cork who were in the film business did a half-an-hour documentary of that interview. And Dr. Bihari was using LDN not only for his neurological patients, because he had been a research director, an addiction commissioner in New York during the AIDS crisis, and it was he who was measuring endorphins, and it was he who first noticed that endorphin levels went up 200 to 300% when you used low-dose naltrexone. A friend of his in Ian Zagon in a research hospital laboratory had mentioned to him that it could be used to block the opiate receptors. And most of his patients were addicts, of course, so he used it in high dosage. But when he brought down the low dose, just in the experiments, and he was doing trials on 1,000 people, he noticed that there was a 200 to 300% increase in the endorphins, and that was remarkable. He thought he'd made a mistake or something, but on checking it again and again, it proved to be true, and it's been proved in other places around the world too. So, but he was also using it not only in his MS patients, he began to use it in all autoimmune conditions, and people started coming to him for fibromyalgia, lupus, other conditions. And I started to do the same, and I've been doing that now since 2004 or 5. And I've nearly 250 patients now with various conditions. And it's been a remarkable eye-opener for me, and successful in a lot of cases. Not all, but a lot. It's like any drug.
Mm-hmm. So your knowledge is quite vast, and we would like to ask you some questions. Is there anything else you would like to add before we get to some questions?
Well, it's also used in cancer. It has been noted, and Dr. Bihari noted it too, that in low dose it seems to have a positive effect on cancer. And in fact, he cured a case of cancer of the tongue with LDN and 10,000 units of vitamin D in his. So, and others have been using it, particularly in London. Dr. Gus Dalgleish is a cancer specialist, and he's using it since 2008, I think, and getting very good results with it. So that has to be noted. And it's also used in other addictions such as alcohol. Claudia Christian, a Hollywood actress, has started what's called the Sinclair method in the US, and it's becoming increasingly popular. Now, how did she come across that? Well, she heard that it was being used in Finland, and she went to Finland. And this is the main treatment in Finland, the government kind of sponsored treatment for alcoholism. And they have apparently an 83% success rate, which is very much higher than any other method. So she brought it back to the US and has started, and now she's bringing it to Europe. I think she's around Europe at the moment and doing talks. So that's important too, to know the different uses of it, you know. Mm-hmm. In Ireland, Chronic Pain Ireland, which is an organisation headed by John Lindsay, he advocates LDN quite a lot, apparently, in his talks, you know. Okay,
wonderful. I mean, we have thousands of members around the world who are taking LDN for many different conditions, and also depression and psychological. Psychologists are using it in OCD, other addictions, post-traumatic stress. The list goes on. We have a list now, I think it's over 240 different conditions that LDN could possibly help. You know, if there is an autoimmune component to it, the chances are that, you know, it could help in some way.
Yes, well, indeed. I mean, that's the whole thing. Your autoimmune situation in anyone's body is terribly important. And Bihari noticed that the endorphin levels were increased, but even more recent research shows a lot more kind of effect on the autoimmune system. So it does certainly seem to help anything that has an autoimmune cause or involvement. And so it's useful. So I'm not surprised that it's that high, actually, you know, which makes the big companies tremble a little, because if it's as good as I say it is, well, then they wonder about their products, you know.
Exactly. Anyway. Okay. Just one quick question that everybody is asking right now is if you're taking LDN, should you be taking flu vaccinations as well? Do the two work together? Should you be taking it or not?
Oh, I have no indication that there's any problem. I mean, people get flu vaccination this time of the year, and I mean, I haven't told anyone not to get it, you know. That's my approach.
Now, I know that you also have been doing quite a bit with fibromyalgia, and we have a question here from Valerie who says, I don't think the LDN is working as well as it used to. I wondered if it's due to the amitriptyline in addition to LDN. I take 4.5 on alternative nights. What should I do?
Yes, well, I don't think it has anything to do with the amitriptyline. Lots of patients with fibromyalgia are taking amitriptyline at night, so I don't think that's related to it. Now, she's taking it every second night, is she? Is that
yes.
just? Yeah, no, I'm not so sure about that approach. I would be taking it every night. Now, but if she's saying that she's not, the benefit is wearing off, or she doesn't really feel it's working anymore, maybe, that does happen in some people. And it may be time related. It may be a period of 4, 5, 6 months, and then it seems to wear off. For most people, it doesn't. Now, I have been very surprised. I didn't know that much. Fibromyalgia is a relatively recent term. I mean, before that, we called it fibrositis and various other things, but it's now fibromyalgia. Now, when I saw my first few cases, I had no kind of preconceived idea of how good or bad it would be, but I have been quite amazed at how good it is in fibromyalgia. I have about 50 plus patients on it now with fibromyalgia, and the vast majority of them are doing very well. And most interestingly, it seems to reverse fibromyalgia in a lot of patients. One of my first patients, a lady who had had it for a few years and was attending the local clinics, etc., she started on it, and you know, it didn't work immediately, but within a few months she was better, and she completely recovered, and she's well today. And I think quite a few fibromyalgia patients, this is what happened, which doesn't happen with MS when you've got, you know, damage done in your CNS. That doesn't reverse, but in fibromyalgia, people actually get better, and you know, I found it quite amazing. Now, it doesn't work in everybody. I'd say it works in 80 to 90% of people, but that's pretty high, you know.
Mm-hmm. And here's a question from May, and I don't know whether you would know the answer to this one, but she says, is LDN ever prescribed for a child with cerebral palsy?
Good question. I don't personally know. I haven't done that. But if you look at some of the commentators in our, I mean, it's used in autism, for instance, and maybe one of those people who are using it in these conditions might answer that, but I personally can't, you know.
Okay. Getting back to the fibromyalgia, we've got so many questions here on fibromyalgia. And from your experience, would you say that it works really well with fatigue, the brain fog, as well as the pain?
Yes. In particular, the fatigue seems to have, you know, been improved in an awful lot of patients. That's the one thing, because fatigue is pretty... I mean, these people look normal. Lots of people don't believe they're really ill. They don't talk about it much because they tend to get kind of ribbed a bit about it, that, you know, you're not sick, you know. But I mean, the thing is, when you listen to them, their lifestyle is seriously affected with it. And fatigue is one of the big complaints, and that does improve a lot in 80% of people, as far as I'm aware, you know.
Mm-hmm. Okay, thank you. We have a question from Don, who is taking LDN for Parkinson's, or is about to take it for Parkinson's, and he says that he takes 22.5 milligrams of mirtazapine and 2 milligrams of melatonin to help with sleep due to his tremor and insomnia. He was informed that LDN should be taken at night. He said, I prefer not to take these drugs, and I hope that in time I'd be able to stop and reduce them altogether. Could he still take LDN alongside of those medications? Because he takes them at night, can he take LDN at night with them, or should he take the LDN in the morning?
Well, he should. I mean, my attitude has been to give it at night, but lots of people seem to think that it's okay in the morning, and apparently it is. I still ask people to take it at night, but if they're having any trouble with their sleep, perhaps because of it, well, then I ask them to take it in the morning. And apparently, according to research done, there's no change in the effect now, but I still tend to ask them to take it at night, you know. Now, using it in Parkinson's disease, again, is something that impressed me. Because I'd have quite a few patients with Parkinson's disease, and these tended to be older, and you know, I didn't know how it would work, but all of the people with primary Parkinson's disease of older age, in their 50s, 60s, 70s, when I was in practice, I had 13 of them on it, and they've all done well, and apart from getting old age symptoms, their Parkinson's seems to have been arrested, and that's great. I didn't realise that, but so I'm using it now in Parkinson's, and particularly in the older age group. And I had one 83-year-old man, and he did very well, you know.
Mm-hmm. Yes, I've heard some wonderful stories from Parkinson's patients, which is wonderful. I mean, to stop those awful tremors is quite a big thing, isn't it?
Yes, it was a bit of a surprise to me, and that it did work so well, but it does, as my experience indicates, you know.
Mm-hmm. We have a question next from Maggie, who has multiple sclerosis, and she says, can I take LDN at the beginning of a relapse, and will it shorten the duration of the relapse? My relapses last on average 7 weeks, and I get them 3 times a year. I'd love not to have to waste so much valuable time being ill and feeling useless. And once the relapse is gone, should I take LDN every day when I feel well and capable, or only when I have a relapse?
Well, I don't know where she gets that information. I don't know anybody who knows a lot about LDN who says just take it when you get relapses. That's not the way it works. She should take it every day. And it's very important with MS, which is a progressive disease. Now, and it stops the progression, according to Dr. Bihari and others. And so, I mean, that's the problem. If she's getting 3 or 4 attacks a year, well, that's a lot. And, you know, I certainly know. Some of the first patients I put on it, including a young woman in her 30s, she hasn't had a relapse since, and she's on it every day. So, I mean, and that's generally, if it works well. And I mean, you just stay on it because it increases the endorphins. And we know for certain that 2 things are very important in MS. MS is popular in the northern hemispheres. It's very common. It's not common in warm climates, in Africa, say, for instance. So it's got something to do with our climate. And Ireland has the highest rate of MS in the world. And the thing is, vitamin D has a lot to do with it. We all think we're getting enough vitamin D. We're not. And recent studies indicate that. We should be getting 3,000 units a day, and we're told that 700 or 800 is enough. But people with severe MS, you know, should take thousands of units of vitamin D, and they're accessible everywhere, in chemist shops or, you know, others. And I mean, that's important. But also, it's very important to take, it's a very low dose of naltrexone. I mean, it's not going to cause you any harm. It's safer than low dose aspirin. And I mean, for it to stop the progression of the disease is remarkable. And I mean, my experience as I say, of those early patients, they're fine and they haven't had a relapse. So that speaks to me very loudly, you know.
Mm-hmm. Certainly a reason to continue taking it all the time to prevent those relapses. I think she would find a a big difference, hopefully.
Yeah, well, I mean, in relation to yourself, I read your chapter in the book, on LDN, and I was surprised at how bad you were before you started taking LDN. I didn't really know that, but I mean, and I've seen you at so many meetings and so on over the years, and you're full of energy, full of go. You work very hard. I mean, you must have had a very good experience with it from your condition.
Well, I have to say, very sadly, when I got back from the conference this year, my mother was diagnosed with inoperable, untreatable, spread bowel cancer, and there was nothing they could do, and she was dying. We promised, my husband and myself, that we would look after her at home, which we did, which did take a toll on me. She died on the 6th of July last year, and I had a relapse. So,
yeah.
But I felt it wasn't as bad as it would have been without LDN. And, the emotional stress and trauma, you would have expected that. So, yeah.
Yeah. Oh, dear. Well, may she rest in peace. Yes.
Yes.
Oh, gosh.
Okay. Yeah. We'll just quickly go to a break. We'll be back in just a minute. Today's radio show is sponsored by Merlin Pharmacy in Galway. They are Ireland's leading LDN pharmacy, offering trusted advice and genuine service. Their pharmacists have extensive experience in all aspects of LDN treatment. If you have a query, they are happy to help. Either email info@ifarm.ie or go to www.ifarm.ie, which is spelled IPHARM. The Lyme disease documentary. Please can we ask for your help and support? We've been trying to raise funds to produce our documentary on Lyme disease. We want to explore all the elements of this controversial disease and to produce a documentary film and an expansive educational resource where all interviews are published. We are almost there, but we still need to raise a further $10,000 to make it the best it could be.
The best description that I've ever heard of Lyme disease was a patient who said, Lyme disease doesn't kill you, but it does take your life away. And I think that sums up how it feels for most people. I don't think there's anybody who's lived for a significant length of time with Lyme disease who hasn't wondered if they would rather be dead.
Please can you help by making a donation today at www.ldnresearchtrust.org/Lyme. Every donation, however small, really helps. Thank you in advance. Welcome back. Right, we'll just go to a next question. It's a general question from Barbara. She doesn't actually say what her condition is, but she says, can LDN cause tiredness and spasticity in my legs?
Generally, no. It's used for that condition in a number of neuromuscular conditions, But at the same time, I wouldn't say absolutely no, because going through some of my cases, I've come across one or two and said, oh, it made the condition worse. And in a situation like hers, I had one patient where it did seem. So, I mean, if that's happening and she thinks, well, just go off it and see what happens. But the thing is, it may, in a very occasional case, make those worse, and it can make your sleep worse too, of course, occasionally, but not commonly.
Mm-hmm. I mean, I have found from my experience with people with MS who have spasticity, starting LDN, they normally have to take a very low dose because it can increase the spasticity initially until their body gets used to it, and then they can build up gradually. So maybe if she has started and she's found that it's just an introductory thing, or maybe her dose is a bit too high for now and she needs to go back. I mean, what do you think about that?
Yes, and I think you're right. Because if you have muscular involvement and it's been there quietly for a while, years maybe, well then, if you're getting improvement, it's going to have to kind of unwind, so to speak, and there may be initial pains or spasticity, and it may increase a little bit, but it's temporary usually a few weeks at the most, and then it improves gradually, so that may happen, yes.
Okay, we have a question here from Kathy, who says she is thinking of taking LDN for both MS and psoriasis, and she said, how long does it usually take for LDN to start working in the body?
Well, LDN starts working within 24 hours usually, but the physical effects mightn't be felt in that time. But in most people, it's within a few days to a few weeks. Now, in things like fibromyalgia, the full effect may not be felt for a few months. But in MS, lots of people feel a bit better in a few days, and that's the way it is, as I understand it from my experience,
Mm-hmm. And we have another question from a Barbara who's got MS, and she says, I was diagnosed with primary progressive MS 22 years ago. I currently work with a walker and I'm under the care of a chiropractor. I take no meds, do some yoga and meditation, have a pretty good attitude generally. Is LDN mostly for pain? I never quite understood what it's for. I do have usual spasticity, but still get around, do my own cooking, driving and shopping, but I'm limited when outdoors and can't walk very far. But I've never wanted to add a drug, especially since it might cause constipation, which is something I struggle with. It seems fuzzy as to what people use LDN for. I've heard one MS patient say it helped with incontinence. I have no idea what it's for. Sorry for this rambling, but I'm not dealing well with huge pain syndromes. This seems to be where LDN shines. Could you give me some advice?
Yes, well, I mean, she's had MS for a long time, and she's actually, her lifestyle is pretty good, and she's doing all the right things. But, I mean, if she wants to know about LDN, well, I mean, there is no doubt that part of the cause of MS seems to be low endorphin levels. All people with MS, if they have their endorphin levels measured, it's low. And I mean, what LDN does is bring it up. So we call MS an autoimmune condition. And we do know that LDN helps mostly all autoimmune conditions by bringing your immune system back to normal. So in fact, it stops the progression. Now, in MS, if you've had it for many years, you have certain damage done, which is there located on the brain. So, I mean, it won't reverse that, but it can improve it a bit, definitely. I mean, brain scans show that lesions in the brain in MS sometimes go back a bit with the treatment of LDN. But, I mean, the main effect is to stop the progress. And, I mean, there's no doubt in my mind that it does.
Mm-hmm. Thank you. We have an interesting question here from Christina, who takes LDN for Sjogren's syndrome. She said, I just started LDN and I've had pericarditis for several months. Have you heard of anyone treating pericarditis with just LDN?
No, not particularly. I mean, pericarditis can be caused by many things, including viruses, and is quite a severe illness. But, I mean, Sjogren's syndrome is claimed to be an autoimmune condition. So if there's a big autoimmune content in it, LDN is worth trying. And, I mean, you just have to try it and see if and when there's any improvement. And if not, well, stop it. But, you could try it for a month or two. It's such a low dose, you're not going to get, any problems with it, but it's worth a try,
Mm-hmm. Okay, thank you. Now we have a question from Joanna, who has CFS-ME, and she says, I'm sorry to bother you, but I'm in such a bad way and I'm not sure who else to turn to. I've heard many wonderful things about LDN and thought it was worth a go as a last resort. I have severe CFS-ME and I've also really bad adrenal fatigue. This happened after a doctor gave me too high a dose of steroids called hydrocortisone, which shut down my adrenal glands. I've read online that with adrenal fatigue, LDN can't help and you can't take it, as it worsens the adrenal fatigue and perhaps lowers cortisol. I just wondered if there might be any doctors who'd be able to help me understand LDN and adrenal fatigue. I've been bedridden with CFS-ME and I'm desperate to try LDN, but I'm terrified of worsening my adrenal fatigue.
Yes, well, she's pretty bad with ME, and adrenal fatigue now is not something I'm that familiar with, but and she got it from too many steroids, but it didn't bounce back. I mean, I don't know if she has any adrenal function now. She must have some, and I mean, with her condition, it might be useful to try low-dose naltrexone for a little while and just see. It's, to me, the effect on the adrenal glands is not anyway remarkable as far as I'm aware. But I mean, if her adrenal glands are low functioning, well, then she won't be functioning greatly anyway. And I don't know if there's anything that can be done about that. But, maybe she can be given some hormones or something. I mean, her specialist should be able to advise her on that. But the LDN, given her ME, can be useful. We know that. But I'm not guaranteeing it, but it's worth a try. And because it's so low dose, I mean, the problems with it are nil practically,
Mm-hmm. Thank you. We have a question here from Tina, and she says, can LDN treat ALS? Please, could you give me more information?
Yes, as far as I know, it can. I think one of the earlier patients that Dr. Bihari had was treated with LDN was ALS, and I mean, so as far as I'm aware, yes, it can be used.
Okay, thank you. Now we have a question from Gretchen, and she takes LDN for MS. She said, I've been taking 3 milligrams for 2 years with great results and have recently increased to 4.5. She doesn't say why she increased. And she's saying, how long should I wait to see if this dose is the right dose for me, or should I go back to 3?
Well, it's a good question. She did so well on 3. And that, I mean, is she doing any better on 4.5? She doesn't say. So, I mean, maybe 3 is the dose for her. A lot of women, and it depends a bit on weight and general body chemistry, but I mean, 3 does seem to help a fair number of people, and they don't have to go up to 4.5. But generally, I think as the range of LDN is from 0 to 4.5. Above that, you're getting into different territory, and that's what Dr. Bihari said too. Now, for things like cancer, maybe it's a higher dose sometimes, but for all autoimmune conditions, I use 1 to 4.5. But if you're very good on 3, and you're not, there's been no big change on 4.5, I mean, she's good on 3. What you're good on, you stay on,
Mm-hmm. That's good advice. Thank you. We have a question from BJ, and they say, any chance LDN could worsen LADA, latent autoimmune diabetes in adults?
Oh, that's a hard one now. Latent autoimmune diabetes. I mean, how latent is it? Are their blood sugars high? Are they being advised to do something? I mean, diet is the main primary factor, so that has to be looked at, and weight and things like that. I mean, I can't really say that using LDN is going to be of any great benefit there. It's the other matters have to be taken first before you consider LDN. But so has he done that? That's important.
No, that's all I had. That was the whole question. But on a side note, I was given a lot of steroids back in 2000 and 2001, and I blew up. I gained loads of weight, and I mean loads of weight. And I became then a type 2 diabetic because I was so ill, I wasn't very mobile. And I was on metformin for 6 years, I think, because I was diet controlled to start with, and then I had to take the metformin for 6 years. I've changed my diet completely after many talks with Dr. Tom O'Brien. So I'm gluten-free, dairy-free, processed sugar-free, processed food-free. So everything is fresh, home-cooked, none of the additives of anything. And would you believe my last 2 blood tests have come back that I'm now a pre-diabetic. So my doctor said, once you have the label as a diabetic, you'll always be a diabetic, but you are now a diabetic in remission.
Yes, good. Well, I've had somewhat similar experience myself. I was diagnosed as pre-diabetic because I had sleep apnea, apparently. And I took some treatment for that, and lo and behold, my sugar is back to normal. So there are other conditions that provoke rise of blood sugar, and make you pre-diabetic, or diabetic even. So, the primary condition has to be treated too. That's important,
Mm-hmm. But
and diet, of course, is very important, like you've just said,
Exactly. And it is, I know people say, oh, that's, really radical. I couldn't possibly do that. Yes, it is hard to start with, but it becomes easier because you reprogram yourself as to what you can and can't eat. And I don't look at foods now. Let's say croissants. I absolutely love croissants, or I did. But now I can look at it and think, oh, that's another thing. I used to have acid reflux, and I used to have to take an anti-acid. Can't remember the brand name now, but one every day to stop the acid, because it was awful if I ate certain foods, and bread and croissants would really affect me. But I have no acid reflux, and I don't have to take that medication either. So that's 2 medications I've managed to drop, which can't be bad, can it?
That's good.
We have a question from Benty, who says, I use GABA to help calm LDN-triggered anxiety in the afternoon. I take LDN in the AM. Is there anything that would be helpful, non-drug-wise, for MTHFR?
Yes, gee, I'm not sure. It was something like meditation, or those kind of techniques can be helpful, or yoga, exercise. I'm not sure why she's getting that in the afternoon. Does she take any exercise? Exercise is very important for your endorphins too.
No, she doesn't say, but she does have another question, and she said, Herxing is such an issue for me. Detox MTHFR issues. What can I do to help?
Sorry, what did you say? The first thing there?
Herxing.
Yeah. Gee, I'm not sure. I'm not an authority on those things, I'm afraid. Sorry.
Okay, well, we'll leave that one. We will just go to a break, and we'll be back in just a moment. Today's radio show is sponsored by Merlin Pharmacy in Galway. They are Ireland's leading LDN pharmacy, offering trusted advice and genuine service. Their pharmacists have extensive experience in all aspects of LDN treatment. If you have a query, they are happy to help. Either email info@ifarm.ie or go to www.ifarm.ie, which is spelled IPHARM. The LDN Research Trust has an LDN Vimeo channel. I have interviewed over 550 LDN prescribers, researchers, pharmacists and patients from around the world for many conditions. You can find the link on the LDN Research Trust website. If you'd like to be interviewed sharing your experience, please email me, linda@ldnrt.org. I look forward to hearing from you. listen to individual radio shows and interviews, go to www.mixcloud.com/LDNRT. I'll repeat that. It's www.mixcloud.com/LDNRT. Okay, welcome back. Now, where do you stand, Dr. Crowley, on tramadol? We have many doctors and pharmacists around the world that have conflicting opinions. Some say that even though tramadol is a synthetic opioid, it can't be taken with LDN, where others say because it's a synthetic, it can be taken with LDN. What's your stance on that?
Yeah, well, that's a good question, and I don't have any absolute view, but I mean, I can understand why the question is being asked, because morphine, codeine, heroin are definitely out, and codeine, of course, is in a lot of cough bottles, etc. But when you come to tramadol, which is synthetic, you know, there is the question, is it really? But I mean, if it does the job of blocking the opiate centers, you know, or it's involved in that area, you wonder. So, I mean, I prefer not to have people on tramadol, but some people are because their pains are bad. But hopefully I'd be asking them, if they take LDN, you know, and they get improvement, well then reduce the tramadol and go off it if possible, you know.
Mm-hmm. Okay. We have another fibromyalgia and candida question from Amy. She says, 3 years ago I had huge gastric candida infection. I'm not sure if this is caused by my fibromyalgia or if I got the infection due to low immune caused by the fibromyalgia. I treated the infection and take probiotics every day and eat carefully, and it's never returned. I'm keen to try LDN, but have concerns with the candida might return. Is this likely to happen? And if so, when LDN is supposed to support my immune system?
Yes, well, candida, and she had it treated. I mean, I don't really think it has anything to do with the LDN. It's there, but I mean, the bowel system is, you know, disordered in a lot of these conditions apparently, and you know, candida may arise. But she's been treated for that, and she's on the probiotics, which is very important. To keep taking those. I personally don't think that the LDN per se is directly related to the candida. So, I mean, you know, she can take it as far as I'm concerned, you know.
Mm-hmm. Okay. We have another question here from Ellie, who's got possible lupus. It's still being investigated. She says, hi there, I'm wondering if you can help. I'm on a small dose of LDN, she doesn't actually say what, and have been experienced muscle twitching, which seemed to increase in frequency when I up the dose. My prescriber doesn't know why this is happening, and I wondered if there was any reports on this or any ideas. It's been ongoing for a few months now.
Yes, well, lupus is a severe disease which can be progressive, and my experience with a few cases of it is that it has worked dramatically well in one case particularly, and you know, person got better, so to speak, and is out and about and active. But I mean, muscle fasciculation with LDN, I mean, they seem to be experiencing that, and that may be particularly in relation to their own case. She doesn't say whether it's just there initially, or is it continuing all the time, and certainly when she ups the dose it increases. So it does seem to be related to LDN. That's a problem, and maybe particular to her, and if it doesn't go, well then it is a problem. She may have to stop it, but talk to her prescriber for that, you know.
Mm-hmm. Okay, thank you. We have a question here from Ruth, and her husband has depression and dementia, and she says, would LDN benefit my husband, and if so, how would we take it?
Yeah, well, I don't have any great experience in using LDN in this, but some of the contributors at the conference have and gave very good talks on it. I mean, it's well known, of course, that the endorphins are your own antidepressants. And when they're low, well then, and if you boost them with LDN, it tends to improve. So, it is certainly understandable clinically how depression might be helped a bit. It definitely improves fatigue and mood in most people when they're taking it. So, that's good,
Mm-hmm. Okay. PSC. I was diagnosed with PSC, this is from Nicola, in 2014, and I'd like to get a prescription of LDN. Is it true that LDN works with PSC?
Well, I don't know. I haven't treated any cases of it. So I'm sorry. I can't answer that one,
Okay, that's fine. We've got a pain question here. Any comments on trying LDN for idiopathic small nerve fibre neuropathy? She says it may be complex regional pain syndrome. Any experience whether LDN might possibly help?
Yes, well, that's interesting. Yeah, it might do, because the microglial cells in the peripheral nerves are the ones affected by LDN, both in the brain and in the peripheral nerves. And you see, that can be helpful. And of course, your endorphins are your own painkillers, so that might help too. But so there may be a double approach to it, and it is worth trying LDN in that situation.
Mm-hmm. Okay, thank you. Now we have next a question from Elaine, who has Hashimoto's, and she said, for those of us taking LDN with Hashimoto's, what signs should we look for as an indicator that we need to lower our thyroid medication, and by how much should we lower our dose to be on the safe side? What examples of signs and symptoms that others have experienced when going hyper on LDN?
Yes, well, no, that's a good question. And I'm not that I don't have cases of Hashimoto's really, but I've read about it, and it is used and it can be useful. But I mean, yes, you can get into a hyper situation. Well, then, of course, that's a problem because your behavior may become noticeably different, and you become hyper, as I say. So what dose then? It needs to be downgraded. Now, the problem with thyroid function is assessing the blood tests. The ordinary blood tests, the TSH and the T3 and T4, they're not that reliable when it comes to the use of LDN. So, you'd want to be going to an endocrinologist to assess the whole thing properly, because it's a complex situation with the thyroid, And I mean, as I say, the blood tests are, when you get them done in general practice, they're not that reliable. I mean, you can read this. I mean, a number of articles in your book, relate to this, and it's quite difficult really to assess that, I'm afraid.
We have another MS question from Carrie. She says, I've noticed that some people take LDN at night, right before bedtime, and some take it in the mornings. What's the big difference between taking it morning versus evening? Would I be losing all the benefits of LDN by switching to AM when I wake up?
Yes, good question, and more people are asking this. Now, the reason that it was given by Dr. Bihari at night is because he had been measuring the endorphins in, as I say, up to 1,000 patients, and he knew that in the ordinary course of events, in the ordinary person, that your endorphins are produced during sleep, 90% of them, between 4 and 6 a.m. if you're on an average night's sleep. So, I mean, that's 90%. There's another 10%, 15% produced in the mid-afternoon, apparently. That's how endorphins are produced. So if you give low-dose naltrexone what it does, it blocks the receptors for a couple of hours. The body notices this. It says, oh, we need more endorphins. And that's how you get the increase in endorphins, up to 300%. So that's why he did it at that time and why I still do it. But it doesn't suit everybody. So people do take it in the morning, and then they wondered if it was working the same. Now, I had my doubts about that, but recent research indicates apparently that the benefits are the same. Now, don't ask me too much about the chemistry of that, but I mean, that's what we're hearing, and so more doctors who are involved with it are saying it's okay to take the morning dose, but I still prefer the idea of the evening dose because of the physiology of the endorphins,
And Carrie goes on, I've been taking LDN for almost 4 years now, and I honestly didn't notice a big difference when I wake up in the morning, energy-wise. I have given it a good try. But when I take it in the mornings, I have tons of energy and I'm clear-headed. Obviously, I don't want to do anything that would hurt me, but I really like the way I feel by taking it in the morning. Now, there is no harm in her doing that, is there?
Absolutely none. She's a good ad, actually, for the morning dose.
Yes.
So, that's very good. Just keep doing it. If it works, keep doing it,
So she also asks, do you have any feedback on double dosing, taking it both night and morning?
No, I wouldn't recommend it because the research initially and up to recently indicates that for autoimmune conditions, 1 to 5 milligrams, i.e. 4.5 maxes, I see it, is what low-dose naltrexone is. Now, if you're going into other conditions like cancer, it may be a bit higher dose. Some people take 9 or 10 milligrams. But I mean, for autoimmune conditions, the low dose is 1 to 4.5.
Mm-hmm. I would say, though, however, and maybe this is where she's getting it from, there are a few doctors that are prescribing LDN for ME, CFS, and have found that LDN does give them a vast energy boost, and some of them are prescribing it night and morning, double dosing. And yeah. I'm told that if you are stable on, say, 3 milligrams, that is your optimum dose. If you then take that at night and in the morning, your body doesn't see it as 6 milligrams, it sees it as 3 milligrams twice, because the first dose is out of your system before the second dose comes. And I've spoken to many people that do double dosing, but I haven't spoken to anybody who take it for anything other than CFS, ME, and they find that gives them more energy.
Yes, well, fair point. I'm prepared to accept that. Particularly for ME, that a double dose may be the thing to do. I personally don't have experience of doing it that way, but I mean, that's more recent kind of practice, and I mean, it may evolve into full-time practice for ME. I can see the benefits.
Yes. Okay. We have a neuropathy question here from Elizabeth, who has it in her hands and her feet. And she says, can LDN be helpful in neuropathy in hands and feet? I take 4.5 milligrams and I started on 3 milligrams 3 years ago. It hasn't helped tremendously. I've been taking 5 milligrams now for a year and I don't feel as good. Should I now go back to a lower dose?
Yes, I think so. She should go back to a lower dose. As I said in an earlier question, the LDN affects the microglia, which are the cells in the peripheral nerves. And usually if they're affecting muscles and things like that it's more noticeable. If it's just pain or sensory problems, it should be noticeable, it should be helpful, but if it's not, I'm not sure what she should do. But certainly she should go back to a lower dose,
Okay, thank you. And we'll have one last question. It's from Karen, and she says her question is to do with inflammation. I'm about to be tested for Lyme disease, and will taking LDN affect the testing?
Not the Lyme disease. And Lyme disease can be difficult to detect properly. The chronic Lyme disease in particular, acute Lyme disease is different and can be treated. Lyme disease, now remember, is an infection and it needs to be treated with antibiotics. But if it's a chronic situation, it's very difficult to get those antibiotics into the cell to treat it. And people in Ireland have been going to Germany and Czechoslovakia and America for treatment in special centres. The Armin Labs, for instance, in Germany, where they get multiple antibiotics, and they do seem to improve. I mean, I know a few people in this area who have gone. Now, the Lyme disease is difficult to assess properly, but I mean, after treatment, the LDN can be helpful. That's true.
Mm-hmm. But would it hinder the results if you're taking LDN?
Not that I'm aware of, no.
No, okay. I mean, we have people asking as well who are in occupations where they're testing for drugs in your system. They do random blood tests. And that one of the questions we're always being asked is, would LDN show up on a blood test for drugs? Well,
I'm not sure. It depends on the laboratory. I mean, you have to specifically put it into your briefing test, that, you're testing for 12 potential toxins or whatever. I mean, they have their routines. Now, I mean, unless they put LDN into that, it won't come up.
Mm-hmm. I mean, if they're looking for somebody who's taking illegal drugs, I mean, LDN wouldn't show up on there at all, would it?
No, it wouldn't.
No. Okay. No. Well, it's been amazing having you with us, and thank you so much for answering so many questions and putting you on the spot like that. It's been amazing. Thank you very much.
No problem. Okay. That's great, and I'm delighted to do it. So take care with everyone there, okay?
Thank you. Bye-bye.
Bye now.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well. Today's radio show is sponsored by Merlin Pharmacy in Galway. They are Ireland's leading LDN pharmacy, offering trusted advice and genuine service. Their pharmacists have extensive experience in all aspects of LDN treatment. If you have a query, they are happy to help. Either email info@ifarm.ie or go to www.ifarm.ie, which is spelled IPHARM. The LDN Research Trust is very proud of the LDN book, which was launched at the LDN 2016 conference in Orlando and has been a great success, not only for the medical profession, but for the patients wanting to learn more about low-dose naltrexone. Full details can be found on the homepage of the LDN Research Trust. Discounts are available on bulk orders of the book, which is 10 or more. For details, email me, linda@ldnrt.org, telling me how many copies you wish and where you live. I will then be able to get Chelsea Green Publishing to contact you. (2017) special offer from Chelsea Green Publishing. Free shipping for US non-bookstore retailers on orders of 25 books or more. For full details, email me, linda@ldnrt.org. A diary date. The LDN 2017 conference. To be held the 22nd to the 24th of September in Portland, Oregon. To check out the details, go to www.ldn2017.com.